थैंक यू वेरी मच डॉक्टर जुनैद। आपका प्रेजेंटेशन हमेशा हमारे लिए आई ओपनिंग और बहुत ज़्यादा इंस्पिरेशनल होता है। तमाम पार्टिसिपेंट से गुजारिश है कि आपके पास जो फोल्डर है उसमें पाकिस्तान अलायंस फॉर अर्ली चाइल्डहुड का एक स्ट्रेटजी डॉक्यूमेंट है जिस पे वेबसाइट और तमाम हमारे जो सोशल मीडिया पेजेस है वो मेंशन है। हम ये सारे प्रेजेंटेशन अपने वेबसाइट पे डाल देंगे, अपलोड करेंगे, आप वहाँ से एक्सेस कर सकते हैं। थैंक यू वेरी मच। ये मुझे पता है आप खुश होंगे। Thank you very much. Our next presenter is Dr. Uzma Bukhari, in charge nutrition, UNICEF Punjab. Dr. Uzma Bukhari will talk about the parenting package, key family care practices, and also she will talk about the nurturing care framework. Ms. Uzma Bukhari, thank you.
Bismillahirrahmanirrahim. Honorable Dr. Tufail Mohammed, Dr. Mohammed Rafiq Tahir, Dr. Professor Junaid Rashid, Dr. Ramiza Kaleem, Madam Shaheen Atikur Rahman, and all the eminent guests and the audience and our colleagues and who are part of this Pakistan Pediatric Conference, and particularly Dr. Naeem Zafar. I'm gratefully thankful on behalf of UNICEF for inviting me here. First, I'll be talking on behalf of Dr. Sabah. She is the Early Childhood Development Manager at Islamabad. She was ill and she was not able to come for this session. I'll be talking for Early Childhood Development Parenting Care Package and the framework. So that's the one. Yeah. Okay. So first of all, we will see that what's the relation between early childhood development and what are the key family care practices which the parents needs to adopt. And my job is very easy when Professor Junaid Rashid has already talked about responsive caregiving, early stimulation, nurturing care framework. I'll also be talking about, because this early childhood development is just not the health and nutrition specific, it's also the multi-sectoral business. It is early childhood learning, it is provision of the water sanitation services and provision of the child protection and the child rights services to the child. So this is a very comprehensive concept which we need to develop and which need to be, inculcate in our policies and programming. So first of all, what is early childhood development? This is the process of maturation and related with the growth from the conception till 8 years, starting from the physical development till motor development and the cognitive development of the child, linguistic development, and also social and emotional and self-regulation skills which start from the conception. The first phase of child life is the conception till birth, which is very important when we talk about the brain development of the child. And when we talk about from birth to 3 years, there are specific interventions which are very important. From the birth, the infant and young child feeding is important. Early initiation is important. And you have seen in the previous presentation that how breastfeeding is strongly connected with the early development of the brain and the neural connections of the brain. And then it is the 1,000 days are important. And 1,000 days starts from conception till 2 years. Why is it is important? We'll talk later. And then starting from preschool, this is 3 to 8 years. These are important for and connected with the early years of child life. And ECD is the process of the development of the cognitive, physical, language, socio and emotional development of the child. And we have seen what is the age. If we see that development is just not an individual process, it has a strong relationship with the environment, in the interaction with the environment, where child interact. It's the mother, it's the father, it's all the caregivers who are involved in the child development process. A healthy and the stable environment helps in the brain development, and it also stimulates the neural connection. Because at the 1,000, why we say the 1,000 days of child life? Because that is the time period when the connections of the neural connection is on the high peak. In the early years, from conception till 9 months of the child life, the speed is 1 million neural connections are being made, and the speed is so high. And the key aspects of environment is nurturing care. This nurturing care is basically responsive caregiving. It is early stimulation, connection and bonding of the child with mother, connection and bonding of child with father, and also all the caregivers. Why it is important? What is important? It's just not, we need to see why it is important that कि माँ ने बच्चे के रोने से पहले ही आइडेंटिफाई कर लिया कि बच्चे को भूख लगी हुई है, क्योंकि बच्चा डिफरेंट सिग्नल्स से बताता है कि उसको भूख लगी है. एंड देयर आर सिग्नल्स जो कि माँ बताती है. जब बच्चे को भूख लगती है तो माँ की मिल्क डिपिंग स्टार्ट हो जाती है. सो दिस इज द बॉन्डिंग एंड कनेक्शन जो कि माँ और बच्चे ने अंडरस्टैंड करना है. दिस इज ऑल्सो, एंड देन जस्ट इट्स नॉट द ब्रेस्ट फीडिंग इज इम्पॉर्टेंट, इट्स कडलिंग, इट्स टॉकिंग टू द चाइल्ड. हमें ये लगता है कि बच्चा जब बहुत छोटा होगा तो उससे बातें करने से हम क्या अचीव कर लेंगे. दैट इज द, हम ये कह रहे हैं कि जब बच्चे की न्यूरल कनेक्शन जो है वो बिल्ड हो रही होती है, सो दैट्स द टाइम जहाँ पे उसकी कॉन्फिडेंस और उसकी पर्सनैलिटी की सारी एट्रीब्यूट्स जो हमें डेवलप हो रहे होते हैं. सो दैट्स नर्चरिंग केयर इन टोटल. What science says about early moments and why early moment matters. Because in the first 1,000 days of child life, the brain sparks new connections. And at this time, as I mentioned earlier, the speed of the neural connection is 1 million per second. And they contribute to the child brain function, IQ development, learning of the child, and also that is the time when the child foundation of the life is laid. And that all process is dependent on the child happiness and the future life. कि बच्चे ने कहाँ पहुँचना है, that is what, ये माँ की गोद है जिसने डिसाइड करना है कि बच्चे ने कितना अचीव करना है अपनी लाइफ में. This is what holistically early childhood nurturing care framework. They build the brain. Why it is important and why it is related with the brain development of the child. More than 1 million neural connections that are, that process is started from conception till 1 year of child life. And over 80% of the baby brain is formed by the age of 3. And up to 70% of each meal goes to building the brain in early years of child life. And the 15 minutes of play can spark thousands of the brain connection. So that is why cuddling, play, talking to the child is important. We can see here that the brain develops very rapidly in the first 2 years of life. And that's not only developing the physically, but also this is actually cognitive development, IQ development of the child. And early language skills and higher cognitive functions develop from, if we see from, in the study, which is it's the study of neurogenesis, and the major development and the vision and hearing and the language and higher cognitive functions develop from the birth to 9 months of the child. So that's the peak when the child achieves major IQ development, cognitive development, and also develops the language, linguistic skills. That's another study which shows another opportunity of child development. This is from 0 to 4 years, which is preschool and the school years. If we see, the major development happens in the first 4 years of child life. And the important, when the neural connections are formed, and this is actually the early years of child life, but from birth to 2 years are very important. Why the early years matters, and why it is important for lifelong health and well-being of the child? Because of the development of core immune system, metabolic regulations, and it has a strong link with breastfeeding, and psychological systems of the child. And these are all functions which decide the adulthood of the individual. There are 3 major pillars. One is early experience from birth to 3 years. And another important pillar is this supporting the parenting care for child development. So this is just not the mother, but also the family members. The father support is very important. And the nurturing care framework emphasize on the role of the father. And quality of early education and early learning is important. There are 5 very important messages which are related to early brain development. The first message is very important. This says that gene is very important, the DNA is very important, but what shapes it is the environment. So that is why early stimulation and nurturing care and responsive caregiving is important. So the relationship between gene and environment is closer than ever before. And gene provide the blueprint for brain development, and the environment shapes it. And this is a very important message. And this relates to Professor Junaid's thing that हमारी माएँ आके कहती हैं नहीं इस बच्चे का तो बाप छोटे कद का है तो इसका भी कद छोटा होगा. नहीं. The environment matter, the food matter, the stimulation matter. So we can change it. And the message 2 is timing matters. If we invest on early years, then we win the game. Otherwise, we miss the boat. And the message 3 is toxic stress during early childhood impact the lifelong. And message 4 is brain complexity. It's not homogeneous, but interconnected. This is why we need to work together. And message 5 is nurturing the mind with adequate nutrition, with adequate stimulation. This is the whole message. The food alone is not important. The responsive caregiving alone is not important. This is interconnected and integrated interventions need to be delivered for the child life and the child development. If we see why investing in young children development is important, because 43% of our children are at the risk of malnutrition, at the risk of diseases, and at the risk of developmental issues. And if we see the neuroscience studies, which says that early childhood is critical, and this is a critical window of opportunity to shape the brain of the child. If we can see the data from all over the globe and South Asia and Pakistan, the overall 43% of the under 5 children are at the risk of development. And if we see the South Asian region, 53% of under 5 children are at the risk of malnutrition and developmental issues. But if we come down to Pakistan, we are even higher. We are 63% of children, which is 12 million children under 5, are at the risk of developmental issues and malnutrition. And we all believe, as the expert, as the in the area of child development, we all believe that this is the child right, and it's basically important for the foundational development of the child, and this is very important for achieving the sustainable development goals. Yeah. This is the statistics which says that what is the situation globally, and then what is the situation at the South Asian region. And also in Pakistan, if we see 40.2% children are stunted and 17.5 children are wasted, according to National Nutrition Survey. This means that we are far away from achieving the sustainable development goal. If we see the health situation, child mortality is 74 per 1,000 live birth, and infant mortality is 62 per 1,000 live birth. So, and with 66% of immunization coverage, we are aiming to achieve the sustainable development goal. And if we see Pakistan water sanitation and hygiene situation, 15 million people are not accessing and have, are not having the defecation facilities. And access to safely managed clean water are just 36%. And Pakistan learning situation, we are the country with the highest proportion of children with learning poverty. We are the second around the world, and 75%, after Afghanistan, which is 93%. And if we see the Pakistan child protection area, we have, child marriages 18%, birth registration 3%. So these are the 4 multi-sector which are major contributor for the child development and child early development. Why nurturing care framework is important? Because it's the holistic framework which is important for the development of child from the birth till 8 years, providing the adequate nutrition, providing the responsive caregiving, and safety and security of the child. This is very important. And then opportunities for early learning, and of course the good health. If child is, in early childhood time, if child is faced with the violence and, neglect, this child will not be able to achieve the outcome in the school. And what is important is providing, this is important, good health, adequate nutrition, safety and security, and responsive caregiving. This is important for the child to survive, thrive, and achieve their full potential. Okay. Continuum of care and what are the key platform? The important key platform is conception till, this is during pregnancy, till the age of 3. And from age 3 to 5 and 6 years, and from 6 to 8 years. This is important. This is age segregation. The first age segregation is basically, conception is related to the mother's health, which is part of 1,000 days, where maternal health and nutrition matters a lot. And then at the birth of child, that early and infant and young child feeding is important. At age 3 to 5, this is the area which is related to education. And age 6 to 8, it's education, water sanitation, and also adequate nutrition and health. Nurturing care is an input which includes responsive caregiving, adequate health, good nutrition, early education, and saving the child from the violence and neglect. And early childhood development is the outcome which we aims to achieve. Thank you so much. I wanted to show the key family care practice, but if Khadija says that yes, presentation 2 then. I just wanted to share the counseling cards and the key family care practices. Yes, sure, yeah. Presentation 2. Okay, I just wanted to show you that there are multiple efforts are being done at the UNICEF global, WHO and UNICEF global level, and there are 22 key family care practices are being made for policymakers, for community level grassroots people, so that we can make some dent to change the practices at the household level. So next, okay, I have to do it. So these are just the output levels where UNICEF and WHO will be working. Now, first is the implementation of nutrition and ECD parenting package, where we aim to institutionalize the early childhood development package. And then it has to be, it has to be included into the government policy documents, and it flows from the vein of the government, from the PC1s to the implementation plans. And then output 2 is community-based structures, and platforms are actively engaged. This is just not the government of Punjab and the government of Pakistan, but also our NGO partners, CSOs, and also the local organization who are working. So this framework, these key family care practices are for everyone. And then output 3 is related to the community engagement. Parents and caregivers, they will be involved for the early childhood development, and their skill will be improved, and they will be practicing these the right practices which are related with early childhood development. So quickly, so these are some of the resource material which are designed at different levels. The first on the left side here is basically training manual for trainers and frontline workers on early childhood development and key family care practices. And the second is the handbook for frontline workers. And then we also have a counseling cards for frontline workers, and which includes 22 key family care practices. If I see, if we just quickly go to the first practice, this is related to husband and wife should talk to each other frequently about family matters, including child health, growth and development, and positive development. This is actually here where the bonding of mother and the father is increased. The child development starts from there. So this is the practice material, how the frontline worker will be utilizing with the ABC approach, which is ask, brainstorm, and the coach. So this is just engaging the communities with these family care practices. Number 2 practice is basically related with avoid unplanned pregnancy, ensure that 3 years of interval between the childbirth. This is related with family planning. And again, this material, how the frontline worker will be utilizing. This we have also translated it into Urdu. And this practice 3 is related to pregnant and women who's receiving the minimal antenatal care services. And then practice 4 is related to delivery of the child and the delivery complications, and all the information which the frontline worker has to say to the mother and share with the mother. And this practice 5 is related to breastfeeding, an early initiation of breastfeeding within 1 hour. And the practice 6 is related to the newborn's health and all the essential interventions which needs for the child to survive and thrive in the first 24 hours for childbirth. So practice 7 is related to the danger signs in newborn and all the information related to danger signs. And okay, so practice 8 is related to the registration of birth. This is related to child protection. So why this is important? This is child registration is important exactly as immunization is important. Practice 9 is related to complementary feeding and dietary diversity of the child at the age of 6 months. And 10 is related to the vaccination. 11 is related to the adolescent health. You see, adolescent health was not added into any, it was not really focused with in any nutrition programming earlier, but this is now focused in our nurturing care framework. Practice 12 is related to pregnant women and saving them from the malaria and all the diseases. And practice 13 is related to child continue to feed and other, and related to, and it's basically related to diarrhea prevention and giving the essential interventions during diarrhea management. And 14 is related to child social need and, how child early learning, to fulfill the child early learning needs. And 15 is related that we need to ensure that men are actively participating in providing nurturing and care to children and are involved in reproductive health initiative. So this is very important for the child life. His mother and father both are involved in the child early development. And practice 16, this is related to child social and child social caregiving from the family and other caregivers. And also, this is important for the maternal health and mental health of the caregivers. And practice 17 is related that all families, this is related to water sanitation services and safe drinking water. Practice 18, now you can see this early childhood development is health, it's child protection, it's water sanitation and education. So we quickly see practice 18 and 19, this is related to protect and respond to abuse of girls and boys and women. So preventing the young girls from early marriages. Practice 20 is related to taking the appropriate action to prevent and manage child injuries and accident. So it's practice 21, 21. It's making sure that children are brought up with warmth, care, kind words, and gentle guidance and positive discipline. And practice 22 is related to early child learning and admission into the school, and it is related to the child learning outcomes. Thank you so much. And, yeah, thank you very much.